The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, everyone. This is Karen Nickel, family nurse practitioner, and this is Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. Before we get rolling, I want to remind you about my course called the Perimenopause Answer. If you are going through this phase of life called perimenopause, or if you don't know if you're in perimenopause, I would love to have the opportunity to talk to you about the course to see if it's the right fit for you. There is a link on our website, itchyandbitchy.com, and our Facebook page, I&B Podcast, where you can schedule an appointment for a Zoom call with me. I'm going to say it again. It's a Zoom call with me. It is not a webinar. So when you make an appointment, I will be sitting at my desk waiting for you to join the one-on-one Zoom call. I was sharing some information about supplements to help with PCOS, polycystic ovarian syndrome, with one of my course members. And one of those supplements is called myo-inositol and D-chiro-inositol. These are forms of a substance called inositol that is found in our body and has benefits for several health problems other than PCOS. So I thought I'd share them with you. There are several forms of inositol, with myo-inositol and D-chiro-inositol being the most common types present in the human body. These two forms are also the types of inositol you will see in over-the-counter supplements. Inositol is involved in controlling many vital cellular mechanisms, such as the development of cells, modulating metabolic and endocrine processes, and cell growth. Because of the importance of inositol in the body, we have had several studies in the last few years that have showed inositol properties that help prevent oxidation, inflammation, cancer, and formation of plaque in the arteries. Additionally, it is reported that low levels of inositol have been associated with metabolic problems, including metabolic syndrome, type 2 diabetes, and PCOS. Recently, a potential role of inositol to treat psychiatric diseases, mood, and anxiety disorders has been shown. What is myo-inositol? Well, for a long time, it was considered a B vitamin, vitamin B8. However, it is not considered an essential nutrient because it is formed from glucose. It is basically a form of sugar, not a B vitamin. Each kidney makes around 2 grams of myo-inositol per day. The liver and brain also make myo-inositol, but they do so at much lower amounts compared with the kidneys. In addition to being found naturally in your body, it is present in a variety of foods. The quantity obtained from food can vary from less than a gram up to several grams per day, depending on the composition of your diet. When given as a dietary supplement, it has a very good safety record. In research studies, doses have ranged from about 2 to 18 grams per day. At higher doses of 12 to 18 grams, some mild side effects have been reported, like stomach upset. However, slightly reducing the dose of inositol appeared to improve these symptoms in some studies. Inositol supplements have even been given to pregnant women at doses of around 4 grams per day with no concerning effects. Inositol has a structural role in your body. It is a major component of your cell membranes. It also influences the action of insulin, a hormone essential for blood sugar control. In addition, it affects chemical messengers in your brain, such as serotonin and dopamine. Unfortunately, the daily requirements for inositol intake has not been established, even though we know through studies that inositol deficiency exists in several animal species. Also, there are several factors that indicate a need to have more myo-inositol. Higher amounts are needed for those who have increased caffeine intake, especially in the form of coffee, increased age, antibiotic use, high sugar and refined carbohydrate intake, those with low sodium, insulin resistance, and types 1 and 2 diabetes. Other factors that deplete inositol include kidney damage, intestinal damage, magnesium deficiency, and the medications lithium and valproic acid. Inositol supplementation can help with mood disorders and health problems that result in insulin resistance. When someone has insulin resistance, their body doesn't transport the sugar and insulin that is in your blood up into the tissue where it is needed. Let's start with inositol and mood disorders. Inositol affects the processes that make neurotransmitters. These are the molecules responsible for relaying information within your brain. Inositol may help balance important chemicals in your brain like serotonin and dopamine, which can affect mood. Interestingly, researchers have found that some people with depression, anxiety, and compulsive disorders have lower levels of inositol in their brain. Because serotonin, a very important neurotransmitter, is affected by inositol, there has been much research that has examined whether inositol supplements can improve symptoms including anxiety disorder, panic disorder, PTSD, which is post traumatic stress disorder, and OCD, obsessive compulsive disorder. Several studies have shown that inositol may be able to reduce the number of panic attacks in those with panic disorders. Myo-inositol at low doses is unable to pass the blood-brain barrier, and therefore high doses of myo-inositol is needed for it to travel into the central nervous system to help address mood symptoms. Doses higher than 12 grams per day are necessary. So high doses of 12 and 18 milligrams per day have been used in studies to evaluate mood benefits of inositol supplementation. One small study of just 20 people with panic disorders found that taking 18 grams of inositol each day for 4 weeks, it was a short time, 4 weeks, reduced the number of weekly panic attacks by 4, an improvement over the benefit of using anxiety medications, where we see a reduction of about 2.4 panic attacks per week, compared to with the 4 reduction using inositol. Another study in people with OCD found that 18 grams of inositol each day improved symptoms better than placebo. Similarly, in a 4-week study, individuals experienced fewer and less severe panic attacks when taking 12 grams of inositol per day. However, there has been very little research examining inositol and PTSD, and no benefits were seen in those studies. And some researchers have questioned the effectiveness of inositol in treating any anxiety disorders. There have been mixed results when inositol is used for depression in studies. Lastly, inositol has been proposed not only as a possible antidepressant supplement, but also as a molecule that can counteract the side effects of mood stabilizers such as lithium and sodium valproate, which are common drugs used for the treatment of mood disorders, especially bipolar disorder. Previous studies suggested that the medications lithium and valproate may reduce the concentrations of inositol within the central nervous system. It is theorized that that is why supplementing with inositol when taking these meds can help with depression symptoms and medication side effect reduction. After this quick break, I will review the role of inositol in metabolic disorders. Some studies have shown amazing benefits using inositol supplementation, and I will share that info with you, so stay tuned. Now on to metabolic disorders. Yay! As I mentioned earlier, in recent years, there has been increasing attention given to the role that low levels of inositol have in the development of some metabolic diseases, including metabolic syndrome, PCOS, and type 2 diabetes. Metabolic syndrome is the label we use in someone who has a group of conditions that include central obesity, high blood pressure, high blood sugar, insulin resistance, high triglycerides, and low HDL, which is your good cholesterol. PCOS, which is polycystic ovarian syndrome, is a metabolic disorder that includes insulin resistance. All of these conditions are related to altered insulin sensitivity. Inositol, particularly myo-inositol and D-chiro-inositol, seem to reduce insulin resistance, thus improving fasting insulin and body mass index. In those with metabolic syndrome, the supplementation with inositol either alone or with alpha lipoic acid may be considered a therapeutic strategy in women since it contributes to increasing both HDL, the good cholesterol, as well as lowering glucose, lowering insulin, lowering blood pressure and triglycerides, and total cholesterol. Inositol was tested in type 1 diabetes patients with a BMI, people who had a BMI over 30. An improvement in insulin sensitivity and a significant reduction in A1C levels were observed, although they did not see a change in BMI or insulin resistance. Interestingly, in people with PCOS, insulin resistance is present in the muscle, fat, and liver tissues, but the ovaries do not become insulin resistant, even though the ovaries aren't functioning like they should in terms of ovulation. This paradox leads to low myo-inositol levels and high D-chiro-inositol levels in the ovary, which leads to abnormal ovarian function. The imbalance of those two forms of inositol is what leads to ovarian dysfunction. This is why combining both myo-inositol to fix the low myo-inositol in the ovary and D-chiro-inositol to fix the low levels of D-chiro-inositol in the liver, skeletal muscle, and fat provides the most benefit in those with PCOS. Over-the-counter supplements to help women with PCOS contain both myo-inositol and D-chiro-inositol. Women with PCOS are at higher risk of experiencing infertility issues since decreased insulin sensitivity may be one of the causes of reduced fertility in women with PCOS. Since inositol may improve insulin sensitivity, it has been studied as a potential treatment for infertility. Studies have found that inositol may be beneficial for improving the function of the ovaries and fertility in women with PCOS. These studies have typically used doses of 2 to 4 grams per day, and benefits have been seen in normal weight, overweight, and obese women, all three. Overall, research has found that inositol supplements may improve menstrual cycle regularity, ovulation, and pregnancy rates in women with PCOS. Looking beyond PCOS, one 6-month study in 80 postmenopausal women with metabolic syndrome found that 4 grams per day of inositol improved insulin sensitivity, blood pressure, and cholesterol levels more than placebo. Also, other research in women with gestational diabetes, and that's when a woman develops diabetes during pregnancy, has also shown benefits of inositol for insulin sensitivity and blood sugar control. Myo-inositol at 2 grams 2 times per day reduces the incidence of gestational diabetes by a whopping 65% to 87.3%. Amazing. These studies also noted reduced requirements for insulin, delivery at a later gestational age, and fewer episodes of hypoglycemia, which is low blood sugar, in the newborn. People with insulin resistance benefit from myo-inositol supplementation because insulin resistance depletes myo-inositol, and it does so because those with health problems that include insulin resistance have decreased production of myo-inositol. They also have increased breakdown of this form of inositol. They have decreased penetration of the substance into the cells, and the cells release more of myo-inositol, and there is greater loss of it in the urine. In someone with diabetes, the tissues of the kidney, sciatic nerve, lenses, and retina of the eye have low levels of myo-inositol. Supplementing with myo-inositol may prevent or delay the development of diabetic neuropathy, nephropathy, and/or retinopathy. Also, research has shown that myo-inositol lowers blood insulin levels and improves insulin resistance approximately 2 times better when compared with the prescription medications pioglitazone or metformin, which are considered the gold standard medications in those with impaired glucose tolerance, which is a pre-diabetic state. 2 times better. I'm not telling everyone who has a mood disorder, PCOS, diabetes, or gestational diabetes to stop their prescription meds that are currently treating the disease process, but based on the research we have, it is worth considering the addition of myo-inositol or a combination of myo-inositol and D-chiroinositol to help manage the problems I've discussed with you. Thank you for listening and for sharing the podcast with others. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings, I'm telling you, really do matter. I encourage you to visit our Facebook page, IMB Podcast, where you can leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. On the Facebook page and website, we have the information about how to schedule an appointment with me, not a webinar, so that we can chat about how my perimenopause course can help you if you are going through this phase in life. As always, thanks to Forrest Wenzel, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you very much, Forrest. As I mentioned before, Forrest has moved to Baltimore to attend the prestigious Peabody Music Conservatory, where he has begun his studies to receive a master's degree in music composition. He has some exciting projects in the works, including being asked to compose a symphony for the spring concert. I am so happy for and proud of him. As I've mentioned previously, he has kindly agreed to continue to produce the podcast from Baltimore so the Itchy and Bitchy podcast can continue. Remember, your health is in your hands.